And Adrian, you've been looking at the second doses, which is a big concern for many.
Yeah, that's right, Cynthia. It's been reported for weeks now. The province is in a race because of the variants to get as many citizens inoculated with a first dose as possible. Now, back to the beginning of the month, the provincial government, the Ministry of Health, said that first dose was proving to be so effective at creating COVID-fighting antibodies that they could push the timeline for that second dose from 4 weeks to 4 months. So there's now emerging data for those with a compromised immune system that's showing that they might need that second dose much, much sooner.
I have to wait 112 days. Is this going to be, am I still going to be safe?
It's a valid question from 63-year-old Cheryl Britt.
I had triple bypass surgery. And just recently, back in October, I had 2 stents put in. And so they classify me as high risk.
On March 3rd, the Thornhill resident was fortunate enough to receive her first vaccine. On April 7th, she was scheduled to receive her second shot. However, this week she received this email stating her appointment had been moved to June 23rd.
I think there should be looking at the individual and what their background history is. And they're not. They're treating us all as the same, and they haven't looked at the people that are high risk.
This week, the American Medical Association's journal released a study out of Johns Hopkins University. In part, it states poor anti-spike antibody responses in organ transplant recipients after the first dose of COVID vaccines suggest that such patients may remain at a higher risk for COVID-19 despite vaccination. The study has Cheryl Britt feeling anxious and uncertain of where her heart condition leaves her.
It was never unexpected that immunocompromised individuals would respond differently or have a more muted response to these vaccines.
As of today, the province of Ontario hasn't adjusted its vaccine plan to ensure high-risk patients receive their booster any sooner than the 4-month waiting period for the general population. However, the Assistant Scientific Director of Ontario's COVID Advisory Table believes that could change very soon.
I'm confident they are evaluating the evidence as it arrives. If they decide to ignore evidence like this and weeks elapse, I think that's a different story. But this is happening in real time.
Provinces like Alberta, BC, and Manitoba have decided to honor second dose vaccination appointments that were made in advance of the move to a 4-month delay for a second dose. But not so in Ontario. Multiple seniors 80 plus are reaching out to CityNews, confused and upset that their previous appointment has changed and they're now going to have to wait months, not weeks. Dr. Nathan Stahl believes at this time it's the right move to make.
So I fully appreciate the extraordinary frustration, disappointment, and even fear that people are having. But to save lives, extraordinary decisions have to be made.
We did reach out to the Ministry of Health today, late this afternoon. They responded in an email saying they're taking their cues from the National Immunization Committee, who's also closely looking at the effectiveness of the vaccine intervals, be it 4 weeks, 4 months, or less.